Hi, my name's Patrick. I have schizophrenia. When I was first diagnosed, I took oral medication daily. But sometimes I would skip a dose or I would double up on a dose accidentally. The doctor said maybe you should switch to a long-acting injectable form of the medication. And that's what I did. In my experience, it's a lot more calm, smoother treatment option.
It's been a delight working with Patrick. It's really interesting seeing his insight, his growth. We have the right tools in place right now. You can think beyond, hey, do I need to take my medicine? So you truly are living a life unfettered by concerns about taking the medicine that helps counter your symptoms.
I only think about taking my medication like twice a year. And for me, that's great. It's like just one less thing to even worry about, you know? I'm focused on finishing my degree, exploring my city, and just living every day not being defined by my diagnosis. It was a much simpler way to be treated. I could just go to the doctor's office, get an injection every 6 months. It's simple. I'm on the right track to success in my life. I can actually succeed and do things in my life that I want to do, even though I have a debilitating illness like schizophrenia. I mean, life could even get in the way sometimes, but you need that stability of your treatment.
What is the most important information I need to know about? INVEGA HAFYERA is a prescription medicine given by injection every 6 months by a healthcare professional and used to treat schizophrenia. INVEGA HAFYERA is used in adults who have been treated with either INVEGA SUSTENNA, a one-time each month extended-release injectable suspension for at least 4 months, or INVEGA TRINZA, a one-time every 3 months extended-release injectable suspension for at least 3 months. INVEGA HAFYERA is the same medication as INVEGA SUSTENNA and INVEGA TRINZA, but provides 6-month control of your schizophrenia symptoms in one dose. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA are not for treating dementia-related psychosis.
I want to inform and educate people about mental illness and maybe show them that people with mental illness can still do wonderful things with their life. So I go to the university right now and studying chemistry. I have 1 semester left before I graduate. I kind of want to go into the health profession, regulatory science, I believe, or clinical trials, maybe medical laboratory science. There's a lot of options that I have going forward. I'd like my support system to know that without their support on my bad days, I wouldn't be who I was on my good days.
In the case of Patrick, we've got somebody that would rather see a glass half full instead of half empty. And when you can work with someone like that, that carries a lot of weight.
My family is stuck by my side. Without the support system, I don't think I could have done as well as I do right now. I'm not just doing this for myself, I'm doing it for my support system.
I am proud of my son, Patrick. He has overcome mental issues that so many people couldn't have come close to what he's done. He is a gifted student.
He goes to school, he works, he drives, and I'm so proud of him, and he's so smart. Patrick is very courageous. To go through this every day, to know that maybe you're having a good day today, but you may not be having a good day tomorrow.
What I see in Patrick's future is fulfillment. I see personal fulfillment, I see professional fulfillment, career fulfillment, hobby fulfillment. I see a lot of different potential things that are going to be the essence or the meaningful things for Patrick.
Patrick, we have a special surprise for you, and you just need to hit the play button.
Patrick, I'm really proud of you. You have managed to get through a lot in your life. What you need to do is share that with the folks that are in the same situation as you, and you managed to get through it. You got to let them know that they can get through it too. And now you're getting close to a degree in college, finally. Yeah, that's pretty good stuff, man. I love you, man. Your mom and I, we love you. Oh, and Gizmo loves you too.
Patrick, I am exceedingly proud of you. You are an exceptional individual, an amazing young man, and what you're doing right now really speaks volumes about who you are. You are helping shatter stereotypes that are outdated, and you're helping bring optimism and the right stance where doctors like myself should be at, contemplating that you can accomplish pretty much anything so long as you have the right aid in place. Keep up the great work, Patrick. Really proud of you.
Hi, Patrick, it's Mom. I am so proud of you. You're becoming a better person every day. And I just wish that I had the courage that you have. I see how you are trying to help other people that are going through the exact same thing that you are. That is so courageous. And you are such a good man. And don't ever think that you're not. And your mom and dad love you very much. For me, I would love for your future to get your master's degree like you've always wanted. Find a good job that you're happy with, and that's most important. I want you to be happy because you deserve it. Love you.
Maybe some advice I would give to someone who is first diagnosed or who's having problems taking the oral dosage of schizophrenia medication. Trust your support group. It's going to be all right. Success is right on the horizon.
Please see the important safety information at the end of this video and speak with your healthcare professional for more information.
Indications. INVEGA HAFYERA 6-month paliperidone palmitate is a prescription medicine given by injection every 6 months by a healthcare professional and used to treat schizophrenia. INVEGA HAFYERA is used in adults who have been treated with either INVEGA SUSTENNA, paliperidone palmitate, a one-time each month paliperidone palmitate extended-release injectable suspension for at least 4 months. INVEGA TRINZA, paliperidone palmitate, a one-time every 3 months paliperidone palmitate extended-release injectable suspension for at least 3 months. INVEGA TRINZA is a prescription medicine given by injection every 3 months by a healthcare professional and used to treat schizophrenia. INVEGA TRINZA is used in people who have been adequately treated with INVEGA SUSTENNA for at least 4 months. INVEGA SUSTENNA is a prescription medicine given by injection by a healthcare professional. INVEGA SUSTENNA is used to treat schizophrenia in adults. Important safety information. What is the most important information I should know about INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA? INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA may cause serious side effects, including increased risk of death in elderly people with dementia-related psychosis. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA increase the risk of death in elderly people who have lost touch with reality, psychosis, due to confusion and memory loss, dementia. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA are not for the treatment of people with dementia-related psychosis. Do not receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA if you are allergic to paliperidone, paliperidone palmitate, risperidone, or any of the ingredients in INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA. See the end of the patient information leaflet in the full prescribing information for a complete list of INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA ingredients. Before you receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA, tell your healthcare professional about all your medical conditions, including if you have had neuroleptic malignant syndrome, NMS, have or have had heart problems, including a heart attack, heart failure, abnormal heart rhythm, or long QT syndrome, have or have had low levels of potassium or magnesium in your blood, have or have had uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia, have or have had kidney or liver problems, have diabetes or have a family history of diabetes, have Parkinson's disease or a type of dementia called Lewy body dementia, have a low white blood cell count, have had problems with dizziness or fainting, or are being treated for high blood pressure, have or have had seizures or epilepsy, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA will harm your unborn baby. If you become pregnant while taking INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA, talk to your healthcare professional about registering with the National Pregnancy Registry for atypical antipsychotics. You can register by calling 1-866-961-2388 or visit womensmentalhealth.org/clinical-and-research-programs/pregnancy registry. Infants born to women who are treated with INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA may experience symptoms such as tremors, irritability, excessive sleepiness, eye twitching, muscle spasms, decreased appetite, difficulty breathing, or abnormal movements of arms and legs. Let your healthcare professional know if these symptoms occur. Are breastfeeding or plan to breastfeed. INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA can pass into your breast milk. Talk to your healthcare professional about the best way to feed your baby if you receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA. Tell your healthcare professional about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA may affect the way other medicines work, and other medicines may affect how INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA works. Your healthcare provider can tell you if it is safe to receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA with your other medicines. Do not start or stop any medicines during treatment with INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA without talking to your healthcare provider first. Know the medicines you take. Keep a list of them to show to your healthcare professional or pharmacist when you get a new medicine. Patients, particularly the elderly, taking antipsychotics with certain health conditions or those on long-term therapy should be evaluated by their healthcare professional for the potential risk of falls. How will I receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA? Follow your treatment schedule exactly as your healthcare provider tells you to. Your healthcare provider will tell you how much you will receive and when you will receive it. What should I avoid while receiving INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA? INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA may affect your ability to make decisions, think clearly, or react quickly. Do not drive, operate heavy machinery, or do other dangerous activities until you know how INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA affects you. Avoid getting overheated or dehydrated. INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA may cause serious side effects, including: see what is the most important information I should know about INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA. Stroke in elderly people, cerebrovascular problems that can lead to death. Neuroleptic malignant syndrome, NMS. NMS is a rare but very serious problem that can happen in people who receive INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA. NMS can cause death and must be treated in a hospital. Call your healthcare professional right away if you become severely ill and have any of these symptoms: high fever, severe muscle stiffness, confusion, loss of consciousness, changes in your breathing, heartbeat, and blood pressure. Problems with your heartbeat. These heart problems can cause death. Call your healthcare professional right away if you have any of these symptoms: passing out or feeling like you will pass out, dizziness, or feeling as if your heart is pounding or missing beats. Uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia. Metabolic changes. Metabolic changes may include high blood sugar, hyperglycemia, diabetes mellitus, and changes in the fat levels in your blood, dyslipidemia, and weight gain. Low blood pressure and fainting. Changes in your blood cell counts. high level of prolactin in your blood, hyperprolactinemia. INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA may cause a rise in the blood levels of a hormone called prolactin, hyperprolactinemia, that may cause side effects including missed menstrual periods, leakage of milk from the breasts, development of breasts in men, or problems with erection. Problems thinking clearly and moving your body, seizures, difficulty swallowing that can cause food or liquid to get into your lungs, prolonged or painful erection lasting more than 4 hours. Call your healthcare professional or go to your nearest emergency room right away if you have an erection that lasts more than 4 hours. Problems with control of your body temperature, especially when you exercise a lot or spend time doing things that make you warm. It is important for you to drink water to avoid dehydration. The most common side effects of INVEGA HAFYERA include injection site reactions, weight gain, headache, upper respiratory tract infections, feeling restlessness or difficulty sitting still, slow movements, tremors, stiffness, and shuffling walk. The most common side effects of INVEGA TRINZA include injection site reactions, weight gain, headache, upper respiratory tract infections, feeling restlessness or difficulty sitting still, slow movements, tremors, stiffness, and shuffling walk. The most common side effects of INVEGA SUSTENNA include injection site reactions, sleepiness or drowsiness, dizziness, feeling of inner restlessness or needing to be constantly moving, abnormal muscle movements, including tremor, shaking, shuffling, uncontrolled involuntary movements, and abnormal movements of your eyes. Tell your healthcare professional if you have any side effect that bothers you or does not go away. These are not all the possible side effects of INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA. For more information, ask your healthcare professional or pharmacist. Call your healthcare professional for medical advice about side effects. You may report side effects of prescription drugs to the FDA at 1-800-FDA-1088. General information about the safe and effective use of INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA. Medicines are sometimes prescribed for purposes other than those listed in a patient information leaflet. Do not use INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA for a condition for which it was not prescribed. You can ask your pharmacist or healthcare professional for information about INVEGA HAFYERA, INVEGA TRINZA, or INVEGA SUSTENNA that is written for healthcare professionals. For more information, go to INVEGAHAFYERA.com, INVEGATRINZA.com, or INVEGASUSTENNA.com, or call 1-800-526-7736. Please read the full prescribing information, including boxed warning for INVEGA HAFYERA, INVEGA TRINZA, and INVEGA SUSTENNA, and discuss any questions you have with your healthcare professional.